Hello everyone. Today we talk about some facts about low back pain and some apprehensions in the people's mind. Many people ask me they underwent a cesarean section. At the time of cesarean section, they had a injection to the back by the spinal anesthesia. And does this lead to back pain? I say it's no, because during spinal anesthesia, the anesthetist uses a very small bore needle, very fine needle, to inject the anesthesia medicine into the back, and that needle doesn't penetrate the bone or the disc. It will just go through the muscles and deposit the medicine in the thecal sac. So this doesn't cause any low back pain. And another set of people are worried that their MRI shows there is a small disc protrusion pressing on the nerve root. Is it a cause of alarm? I don't think so. Not every disc protrusion is a serious kind of disease. So this disc protrusion is serious when it causes any red flag signs. Some people are worried carrying their MRI scan with the report that there is a mild disc bulge pressing on the nerve roots and there is mild compression of the lateral recess. Is this a cause of worry? I say unless there is a serious problem like a red flag sign. Red flag sign means something dangerous happening. The red flag signs basically are if there is severe pain going down the leg, or if there is weakness of the leg, if there is loss of sensation in the leg, or if there is bladder incontinence or bowel incontinence where you don't have control of the bladder or bowel. And also if there is a night pain or if there is a fever. Fever indicates infection. If there is a night pain, it indicates some kind of tumor or tumorous process going on. Or if there is an early morning stiffness which indicates arthritic kind of condition like ankylosing spondylitis. These are the kind of situations where you have to worry and immediately approach the doctor. But a small minor disc bulge pressing on the nerve root causing no big symptoms like this, red flags, shouldn't be a worry. So once you have a small disc bulge with a pain in the back or minor pain going down the buttock, so you consult specialist and take their advice and take medication and take physiotherapy and strengthen the muscles and correct any dietary deficiencies of vitamin D, calcium and minerals, and take balanced diet with rich in protein, and you have to lose weight if you are overweight. So these methods usually prevent repeating back pain, and also you have to adopt a good posture while sitting near the system in front of the computer, and you have to take micro breaks between every 45 minutes. Micro breaks from your get up from your seat and just go around for a few minutes and come back and sit again, and avoid prolonged sitting at a stretch. So these methods will prevent you from getting back pain repeatedly. And also when we think of a disc problem causing severe sciatic pain and not responding to physiotherapy and medication for a long time, then probably your doctor will advise you discectomy, microscopic aided discectomy or endoscopic aided discectomy. In microscopic aided discectomy, we create a small hole in the back and remove the offending disc pressing on the nerve root and free the nerve root from compression, thereby relieve the pain. In endoscopic discectomy, you make a small hole. Through the small hole, you will introduce the endoscope and remove the offending disc pressing on the nerve root and thereby relieve the pain in sciatic pain in the leg. If the patient is having a different set of problem like spondylolisthesis, where there is a slippage of the vertebra one or the other forwards, so in this condition called spondylolisthesis, there will be compression on the nerve roots and there will be back pain, and also there will be symptoms like sciatica and sciatic pain down the leg, and sometimes there will be loss of sensation or weakness of the legs. So if initially spondylolisthetic patients are offered conservative management, non-operative management with physiotherapy, medication, and mineral supplement and back support. If the pain doesn't get relieved, probably they will be advised surgery called spinal fusion, wherein the unstable vertebra are bound together by pedicle screws and rod systems, and there will be bone grafts kept there between the two vertebra to allow them to fuse over time, and this is called spinal fusion operation. This relieves the pain in the leg and also in the back. And in elderly set of population, because of the osteoporosis are called the brittle bones, because of the strength of the bone is weakened because of the age, loss of protein, loss of calcium and structural integrity of the bone in the vertebra collapses, and this causes pain in the elderly. So in the initial stage, in the first 3 weeks, they will be treated with injections like pain medication and physiotherapy and back supports, and sometimes hormones like salmon calcitonin nasal spray and the parathyroid analogs are will be given. And if these kind of treatment fails to relieve the pain in this set of patients, then these patients are subjected to pinhole surgery called vertebroplasty or kyphoplasty. So in vertebroplasty, a small bone biopsy needle is used where a small nick in the skin is made, and it is passed into the affected bone, and the bone cement is injected into the collapsed vertebra and thereby strengthening the bone, weakened bone, and relieving the pain. So this relieves the pain in the elderly. And in patients with early morning stiffness because of arthritis like ankylosing spondylitis, that is called sacroiliitis, in these patients, they will be referred to the rheumatologist for further treatment for the underlying systemic ankylosing spondylitis condition. Thank you.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.